Across Washington, the need for mental and behavioral health services is greater than the providers available to deliver them. Job vacancies for master's level or higher licensed behavioral health providers range between 30 to 50% depending on the geographic region. To expand access to timely mental health care, Washington State has created the new Behavioral Health Support Specialist, or BHSS role. This role was established by the legislature in the 2023 legislative session through Substitute Senate Bill 5189. Positioned between non-specialist and the graduate level, a BHSS is a bachelor-level provider certified to deliver brief, evidence-informed interventions like behavioral activation for depression or brief cognitive behavioral treatment for anxiety. A BHSS works in a team-based environment and uses measurement-based care to track client progress under supervision. Though a BHSS engages in screening and assessment activities, they do not diagnose mental health conditions. They also cannot engage in private practice as a solo practitioner. BHSSs may work in any setting where mental and behavioral health services are offered with an approved supervisor. Settings might include community behavioral health centers, rural health centers, integrated primary care settings, crisis service settings, college counseling centers, senior centers, and more. With certification, BHSS services are billable through state Medicaid and private pay insurance. A BHSS is trained to provide brief psychosocial treatment as a first step of intervention. If a person requires more intensive services, a BHSS may refer to a licensed provider prepared to treat complex conditions. To become certified, a BHSS has demonstrated appropriate competency in the areas of health equity, helping relationships, cultural responsiveness, team-based care and collaboration, screening and assessment, brief evidence-based psychosocial interventions, care planning and coordination, and law, ethics, and professional issues. A BHSS is eligible for certification when they have graduated from a psychology, behavioral healthcare, social work, or related bachelor's degree program approved by the Department of Health to deliver BHSS training and education. The program must include 45 quarter credits of BHSS-related instruction and a 240-hour practicum with close supervised experience with patients or clients. A final step towards certification is completion of a state issues exam on laws and rules related to BHSS practice. People who might choose a BHSS specialization or certificate may include those currently employed as mental health case managers, substance use disorder professionals, health coaches, medical assistants, or community health workers. As previously mentioned, a BHSS practicum student and certified BHSS delivers services under supervision. This supervision is meant to support ongoing skill development as well as prevent therapeutic drift when a BHSS delivers brief, evidence-based psychosocial interventions. Only Washington State credentialed providers who assess, diagnose, and treat mental and behavioral health conditions as part of their scope of practice can supervise a BHSS. Some examples of these roles include licensed, independent clinical or advanced social workers, psychologists, mental health counselors, physicians, or psychiatric nurse practitioners. As a supervisor of a practicum student, it is required to provide regular and consistent outcome-focused supervision and ensure feedback aligns with the BHSS core competencies of health equity, helping relationships, cultural responsiveness, team-based care and collaboration, screening and assessment, brief evidence-based psychosocial interventions, care planning and coordination, and law and ethics. Similar expectations exist for employment supervision of certified BHSSs. Adding a BHSS to a mental or behavioral healthcare team is meant to strengthen that team's capacity to serve more clients in need of high-quality mental health care. Behavioral health support specialists are expected to improve access to much-needed mental and behavioral health services and ease the workforce shortage while helping behavioral health professionals work at the top of their scope of practice. For full details on requirements, application procedures, and fees, visit the Washington State Department of Health website.